Hello, my name is Nurse Yab. How about doing your physical assessment today? Can you tell me your name and date of birth, please?
Med Smith, 6848.
Okay. Let's start out with a hair, skin, and nail assessment. Can I see your back of your hands and your nail beds and your nails? And let's do a cursory hair assessment, parting the hair, looking at the scalp. The hair roots, looking for nice lesions. And can you please look at me? Here we're looking at the eyes symmetry and the eyebrows and the eyelashes, the sclera, the cornea, and the conjunctiva. Please, can you pull your eyes down? Okay, thank you. And we'll do a visual acuity test. Can you please cover one eye and read the lowest line?
DHJBS.
Okay, and let's switch.
DHJBS.
Okay. And let's do a extraocular muscles of the eye test. This will be for please follow my finger. And for convergence. Okay. And now turn towards me a little bit. We'll test for peripheral vision with confrontation. Please tell me when you see my hands.
Yes. 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 Yes.
Okay. Now let's look at the reaction to light. Please look at a point here. And we'll look at the anterior structures of the eye for any cloudiness. Please look straight ahead. Okay, and now we'll move to the ophthalmic exam on the dim lights. Checking camera lighting, okay. First we'll do the left eye. Ophthalmoscope in my left hand. Please look at a fixed point behind me. Looking for the red reflex. We'll follow the blood vessels in for the optic disc. Looking at the 4 quadrants of the eye, and please look at the light. And we'll look at the macula. Okay. Okay, now we switch to the right eye. In my right hand, please look at a fixed point behind me. And we see the red reflex. The blood vessels lead to the center of the eye. We see the optic disc, and please look at the light. And we see the macula. Okay. Okay, and now we'll switch to inspection of the ears. We'll look inside the ears with the otoscope. We'll pull the pinna up and back. Looking at the tympanic membrane. Okay, and for hearing acuity, I'll stand behind you and I'll whisper 2 words and you repeat them back to me. Cover your right ear, please. Cat. Pet. Tree.
Dream.
Okay, let's switch ears. Dog.
Dog.
Car.
Car.
Okay. Let's do inspection of each ear, each auricle. Inspect and we'll palpate nodules, no lesions, no nodules. Okay. And now we'll move to the nose. We'll look at the nose symmetry and center line, and we'll check for patency. Can you please plug one nostril and switch? Okay. And now we'll look at the turbinates and the otoscope tip. Take your head back, please. Okay. Now we'll move on to the mouth oral exam. Can you please open your mouth and tongue up, tongue down, lateral, sides, okay? And stick your tongue way out and say, ah.
Oh.
And looking at the pharynx, okay? And let's look at the gum, teeth, and lips. Upper lip up, please. Okay, and down. Perfect. Okay, and I want to assess the temporal mandibular joint. We'll palpate for that space in between and open and close. Okay, no clicking and no tenderness. And we'll also check for the sinuses, or checking for tenderness with firm pressure. Temporal and maxillary. And then we'll move on to the lymph nodes. We'll do preauricular, posterior auricular, and occipital. We'll do tonsillar, submandibular, submental, superior cervical, superficial cervical, posterior cervical, and finally supraclavicular. If you can shrug your shoulders for me, please. Thank you. And face the camera, and while we're here, we'll feel and palpate for the thyroid. And feeling for the lobes and the isthmus, and please swallow. Okay. And finally, we will do the lung assessment, and we'll do all percussion together. So we'll start at the front. And last one underneath. Okay, let's do the left lateral. We'll turn to the side. And let's turn again for posterior. We'll do one more at the bottom. And let's do the right lateral. Okay, and stay here. We'll auscultate. Same landmarks. And lift up, please. And take a deep breath through your mouth every single time I move the stethoscope. Good? Okay, let's do the posterior. Okay, deep breath. Deep breath. Good. Good. And last one. Okay, let's do the left side. Deep breath. Okay, and the front. And last ones are lower lobes. Okay. That's it. Thank you.